mandate. Dr. Brown's already talked about the Medicaid expansion, but the cuts in Medicare. So I'll yield to my colleague from Louisiana.
Thank you. I appreciate you throwing number 4 to me, because that's the one that I think gets my gall the most, quite frankly. Mr. Speaker, you realize that in Obamacare, $500 billion is taken from Medicare, and this is not just window dressing. This is real cuts that are occurring actually as we speak, are actually being scheduled, starting with psychiatric care, including care for assisted living, home health care. Virtually nothing is being touched, and that so-called $500 billion of savings that's being taken out of Medicare is being used to do two things. Number one, to tack on the end of Medicare, because it's running out of money in 6 years, to extend the life, and I still, after a year, cannot get an explanation how you take the money out of something and add it back in and make it last longer. I know I could try that budget at home and it would never work. Secondly, the same money is being counted again in this bookkeeping scam that will subsidize the middle class, lower income classes in terms of their private health care. And so this is just more gimmicks, more Washington gimmicks. It's going to hurt a lot of people.
Yield to me just for a second,
sir.
on the, Mr. Speaker, I wanted to, and I know the gentleman from Louisiana and the gentleman from Georgia know this, but to remind my colleagues, that cut to Medicare that Dr. Fleming is talking about, Mr. Speaker, is $528 billion over 10 years. It's about a 10 to 12% a year cut, annualized, and it includes cutting Medicare Advantage, $160 billion. It includes hospital cuts, cuts to hospice, that organizations care of people that are dying of cancer, cuts to nursing homes, home health cuts. But again, it's kind of embarrassing almost to see these television ads, Mr. Speaker, about Medicare, or get some flyer, some glossy flyer in the mail, those of us who are on Medicare, touting the benefits that Obamacare has brought to the program and how it's going to make it so much better, and yet it cuts $528 billion out of the program. I agree with the gentleman from Louisiana, and I yield back to him.
And I thank the gentleman, but even before we get to those cuts, it's already steeply increasing the premiums of average everyday citizens. There is no way that you can cover an additional 32 million Americans. I mean, this is empiric fact. There's no way you can increase the coverage, add to the coverage of 32 million Americans, and raise through special interest all the additional bells and whistles into those plans and not see the cost go up. And why in the world the American people could ever get hoodwinked into believing that, I don't know, and I don't think they did, which is frankly why they want, by a vote of 60% in the polls, they want us to crush Obamacare and replace it with something that's common sense, free market based, that leaves the decision making up to the patient, and that is efficient rather than, again, some government controlled program. We know that also, finally, just kind of a final comment, because I know we're getting close to the end, but increased coverage does not mean increased access to care. We know this. There are countries around the world. Our neighbor to the north, Canada, has 100% coverage, but they do not have 100% access to care. They have to wait often well past the time frame in which it takes to actually adequately treat a condition, therefore access. So what good is coverage when you don't have access? And so we're going in that direction. So I suggest, Mr. Speaker, that we repeal Obamacare and replace it with something that will properly match the efficiencies of the system, allow it to be patient-driven, and that people get timely care at an affordable cost.
Mr. Speaker, reclaim my time, and I thank the gentleman from Louisiana, and my colleague from Georgia may want some last few seconds of comments, and I yield to him.
Thank you, Dr. Gingrich. I just wanted to mention a thing about the employer mandate.